But first, as Republicans on Capitol Hill try to repeal and replace the Affordable Care Act, we're going to spend the next couple of nights hearing what patients and health care providers think should be done. Our team visited West Virginia and Virginia, which made very different decisions about Medicaid. West Virginia did commit to expanding Medicaid through Obamacare, but Virginia is one of 19 states that did not. The state's Republican-controlled legislature voted against expanding the program to 400,000 more citizens because of concerns over costs. Tonight, we visit a clinic providing free care in the western corner of Virginia, a region that strongly supported the election of President Trump.
My name is Dr. Paula Hill. I'm a family nurse practitioner and clinical director here at the Health Wagon. We're at the Smitty Clinic in Wise, Virginia. We actually say that we're the forgotten Virginia because we're down in the corner with Tennessee and Kentucky borders, and we're very rural, very mountainous, and very isolated from the rest of Virginia, and in a lot of ways the rest of the country. We have a high rate of heart disease, diabetes, and it's because of the economics here.
All the mines and stuff is just about closed down, and there really isn't any jobs around here. My name is Joyce Campbell. I'm from Wise, Virginia. You know, I get $800 a month, and I'm fortunate I do have an income coming in, with my Social Security.
How are you? Oh, I'm fine.
And time you pay your rent, your electric, your water, your gas, you either have a choice of whether you want to buy your medicine or whether you want to eat.
Yeah.
The Affordable Care Act, when it was enacted, it did help a lot of Virginians. Down here in this part of the state, in far southwestern Virginia, we did not benefit as much because there is such dire economic constraints here. Our patients couldn't afford the Affordable Care Act. They couldn't afford $400 a month for a family plan. And Virginia did not expand Medicaid. We actually didn't benefit any because it would have helped if we had expanded Medicaid, and it would help some of our residents anyway because there's a dire amount of poverty. Do everything we can to help you, okay? There's people dying every day and dying senseless deaths because they don't have equal right to health care.
My name is Tina Bean. I'm 59 and I'm from Hayside, Virginia.
How are you?
I'm doing fine, honey.
Let me give you a hug. Thank you for coming.
I had congestive heart failure twice. I didn't have insurance, and that's when I started coming to Paula or coming to the Health Wagon. Without the medicines and stuff, I probably wouldn't be here. When I heard about the Obamacare a few years ago and checked it and stuff, you could tell then that it wasn't gonna work. People can't afford it.
They call it Affordable Care Act, but it's not. And they said you could keep your doctors. You couldn't because the doctors wouldn't take the thing. So, and they said you could go to the same hospital, but a lot of it was built on lies. If you really want to know the truth, I think somebody one of these days is going to give an account for it.
My name is Jeff Tiller, and I'm 47 years old. I worked in the coal mines for 29 years. They diagnosed me for black lung. They done chest x-ray.
And Dr. Smitty will be in here and get your chest x-ray done and see if the black lung's gotten any worse.
They also have found some nodules in my lung.
We are overwhelmed here at the Health Wagon. We have went to almost over 9,000 patients, and we have a staff of less than 20. Every year we have an outreach clinic event called Remote Area Medical. You'll see them standing in line for dental care, for medical care, for vision. We have found people with dissecting aortic aneurysms that's had to be flown out. We've had patients have a stroke right there in front of us at these remote area medical events. We've had brain tumors that have been discovered, lung cancers that have been discovered. And every year it's like this. We keep thinking, well, is it ever going to get better? Is anybody going to help these forgotten people? They're like something you would see in a third world country.
The Obamacare could have helped some people. I say it needs to be replaced.
I hope that they can replace it. I know it's not going to be something they can do overnight because it wouldn't. The mess didn't come overnight.
When I first started hearing that Obama getting ready to for Obamacare, I thought that was great.
Okay, every time I touch you, I want you to take a big deep breath.
We tried it. We got it. Does it have faults? Yes, it does. Is it working? Yes, it is. And I know right there in my hometown of people that's got insurance through the Affordable Care Act. And if you reverse it, they lose their insurance.
If all this goes through, I probably won't have anything. I mean, I don't know how I'm going to get covered.
Because,
And I'm
because
worried
of the
sick.
pre-existing conditions.
Yeah, right. And I've had it for years.
If the Senate plan actually passes, there will be deep cuts to Medicaid. Even though Virginia didn't expand, what they are paying out is going to be even subjected to even more cuts.
How are you today?
Then you have the preventive care that's being discussed that they're not going to be paying for anymore. Just because it wasn't a perfect plan, it doesn't mean do away with the whole thing. Why can't we build on it and repair it? Not take it away and then start over with another plan that's not perfect and not ideal.
It helped the insurance company because they made all kinds of money off of it. But as far as helping a lot of poor people, it didn't, and it still isn't. Now, we cannot afford the high cost like Obama had there. There's no way that people in Southwest Virginia can handle it. Now, maybe up Washington or way up, you know, where there's money and jobs, you could. But there's neither money nor jobs here.
They need to do something to help it. And hopefully, the administration now, maybe they'll do something.
Washington, come to Southwest Virginia.
Come down here and look in their eyes and don't forget where you came from. Don't forget who put you in the position that you're in.
Check the people. Look at them. Go sit on the street. Go bring your car and park it and look at the people that are hurting. And then if you've got a heart, you'll know what it needs.